All right, welcome everyone. It looks like we have a nice sized group today. Welcome from all over. My name's Troy Jenkins. I'm the Director of Enrollment here at ACHS. If you have not updated your Zoom in a while, like I had not, it is a little bit different. So if you're coming back in and you see different icons, take a moment to reorient. The one thing I will point out is in the chat. So just make sure you're set to everyone instead of host and panelists. That way everyone can see your messages. So, and while you're taking a look at the chat, let us know where you are joining from. And I'm also curious what the temperature is like where you are, because where I am on the East Coast, we went from 80 degrees to 20 degrees back to 60 in the span of a week. So hopefully everybody is hanging in there. But yeah, let us know where you're joining from, and we will get started. Let me just make sure. There we go. Oklahoma, 84 in Nevada. Nevada, excuse me. I think it's Nevada. Wow. Okay. So we've got pretty much the whole country represented. Fantastic. Welcome, everyone. Um, so let's go ahead and get started with some beginner stuff. It's always important for us to start conversations with a review of our mission and vision. This is what we are always focused on whenever we're working with students, for students, and trying to direct where we're headed in the future. So our mission is to lead the advancement of evidence-based integrative health and wellness education through experiential online learning and its sustainable practices. And our vision is a world where integrative health and wellness education is accessible to global communities, promoting sustainable and healthy futures for all. There's a lot in there, but that's what informs our decisions every day. Today, for this webinar, I feel like the leading the advancement of evidence-based integrative health and wellness education is really what we're kind of talking about today when we talk about professional credentials, and those things that we're trying to set up pathways for our students. So welcome. I'm joined today by Dr. Patricia Kaufman. Um, who is going to be the expert on today's webinar. We're going to cover a lot of ground, and I'm very excited to have her here with me to help answer some questions that we get. Hopefully, that'll be helpful for you. As you can see, as we talk about professional credentials, Dr. Kaufman has completed some of the ones that we are going to be talking about today. So we really appreciate her expertise, being a resource for us here at the school. She's always so helpful when we're working with individual student situations. So excited to have her on with us today.
Thank you.
So we're going to cover a couple of things today. We're going to talk a little bit about what professional certifications are. That seems simplistic. You may already know what they are, but we're going to cover what are they and what are they not. How does ACHS fit into that? Just as a beginner to set the stage for what we're going to talk about after that. And then we will go through an overview of there was three in the description for the webinar. We're actually going to touch on four today just to cover an extra base. And we're going to try to keep that at a high level. So we're going to cover some of the basics of what is the credential, who administers it, what are some of the main questions that we get from students about it, and what are the answers to those, and what are the requirements. You may have very specific questions about your situation that you want to get answered. We'll do our best to answer those along the way, but it may be something we have to follow up with you on after the webinar if it's very specific to your situation. But we'll do our best to keep up with questions along the way. There also have been several webinars about these credentials in the past. We just had last month Nicole Hodson on to talk about the BCHN, which we will touch on again today. Fantastic webinar. She gave us a ton of very specific, detailed information. And so to cover that much ground for four of them today, we're not going to be able to cover all of that, but I do encourage you to take a look at that one if you haven't. And there's one for the CNS as well. And so lots of resources to help you out there. So let's talk about what professional certifications are. So our goal at ACHS is to always be looking out for opportunities that help our students in the professional world, should they choose to take advantage of those. So what are things that help professional credibility? What helps them get more noticeable? What helps their education go further out there in the market? So enhancing that professional credibility, these professional certifications and credentials that you have the opportunity to pursue are not necessarily a result of the education or the academic program you take with us, but our goal is to make sure we are aligned as best we can with these organizations that handle these so that you're prepared to take those. Um, there are a number of obstacles out there in the world today where state regulations or the rules in specific states are not the same everywhere. So certain states can do different things. They can call themselves different things. And there's certain titles that they may or may not be able to use. So these professional credentials help level the playing field a little bit as a nationally recognized credential that's not state specific in most cases. So um, keeping you recognizable on a national scale, and then also helps you network within the environments that you're professionally working as well. People recognize what the CNS is, the BCHN, all of these that we're going to talk about today. So um, and it also creates a system of consistent benchmarks. So the we mentioned, we align our programs to lead to these professional certifications. Um, that means they have to come in and approve what we're teaching, make sure it leads the right place, and that to us helps us make sure that we are in line with what is expected out there in the professional world from the experts and the ones that are recognized in the field. So overall, the best thing we can do is continue to seek out these professional alignments with these organizations. We'll continue to do that. But one thing that we will say is sometimes there are a lot of them that come at once, and they can be a little confusing to keep all of the letters and the all the acronyms and things like that straight. So hopefully today we'll be able to sort out what does what and give you a little bit more clarity there. And it looks like we may have some audio echoing. Is anybody else having that experience? Okay, hopefully not, Tanya. Hopefully it clears up for you. Okay, great. So let's jump in. So Dr. Kaufman, thank you for being with us. I appreciate you talking through this with us. The first credential we're going to talk about is the National Board Certification of Health and Wellness Coaching. Um, can you just give us a quick high level of your thoughts on that credential, what it's best for, who is it best targeted at, things of that nature?
Sure. The NBHWC is the organization that gives the credential, the NBC-HWC. So a lot of acronyms.
A lot of letters.
And you're right. And you'll find that throughout all of these different credentials that there's all these acronyms. So this one is for wellness coaching. And one of the important things to keep in mind with getting a credential in the HBCHWC is that the American Medical Association use coaches with this credential. And so that's huge. And why do they use them? Because they can use insurance, they can code insurance. So these coaches can be covered by insurance. And so a lot of several doctors, practitioners really like to use coaches with this certification. And the reason why they like the NBHWC is because the NBHWC ensures that those that get the credential have the right coursework. They have the right expertise. They have the right skills. And so we at ACHS offer a grad certification in wellness coaching program, and it's 5 courses. and it gives you the right coursework to then go do your 50 coaching sessions and then sit for the board exam for the NBHWC.
Great. And yeah, so that's part of the requirement there. Obviously, when we talk about requirements, we're going to hit the high level on those as well. There are a number of individual, unique situations that can arise, and in all of these, what we would encourage students to do if they have a specific anomaly in their educational history is to reach out to the organization to see how would you handle this? And we have some contact information. If you click on that link when you get the presentation, it'll take you right to the website. Um, so you'll be plugged in there. Sometimes it's things that they need to review and answer. But one of the things that I will call out is, uh, as Dr. Kaufman mentioned, the Graduate Certificate of Wellness Coaching is the approved program to lead to the NBHWC certification. However, that program was approved at a certain time. So for it to fall under an approved course of study, you would need to have completed it on or after April of 2025. Is that correct?
That's correct.
Okay.
And to keep in mind, it's 5 courses. So if you're in another program at ACHS that covers those 5 courses, and you take NAT 515 with the coaching, the NBHWC coaching edition, then
Mhm.
you would have the right coursework to then go sit for the exam.
Right. So that's an important distinction. There are some caveats to that as well. You know, a question we got recently was, I took a course at AC or a program at ACHS 7 years ago, and I took similar coursework to this. I just need one of these that I'm missing. If I finish that, can I take the MBHWC exam? Well, just due to the dates of those course completions, it wouldn't fall into the approved range that the organization worked with us on. So there are some unfortunate situations, but like we said, we're always looking for these opportunities and getting them started as soon as we can to benefit as many people. But you're right. So within the Masters of Science in Holistic Nutrition, for example, you could theoretically take the courses that are in the grad cert of wellness coaching or the masters of IHS and have those as a part of your electives or part of your core coursework, and then finish that out and get that grad certification while you're completing your master's. Um, so you have the credential or the program and the coursework covered. From there, there are a few other things, and we'll talk about this. All these have some sort of extra component. For the NBHWC, you also have to have completed 50 coaching sessions, which are logged on the NBHWC coaching log. Can you speak to that a little bit, Dr. Kaufman?
Sure. The NBHWC, when you register to go down or to do the pathway to get your credentialing, they're going to give you the log. So they'll give you a standardized log that you log your 50 coaching sessions. There are coaching sessions, not hours. And I believe the coaching session is 20 minutes long.
Great, good to
So
know
out
that.
of all the ones we're going to talk about, this is the least amount that has uh, hours that you need to accomplish.
Right. And then lastly, you have to apply for the exam. So if you feel like you've covered all the bases to be eligible, you can apply. But like I said, if you're not sure, it's always helpful to reach out to the organization and just ask questions. You know, would I be eligible with what I have? And they may do a transcript review, things of that nature, just to see um, what you might be eligible for. We have a question about undergraduate students for the coaching sessions. Would this be accessible at all to undergrad?
Um, I'm a little unclear on what they mean by the coaching session. You would still need to do the grad cert program or those 5 courses before you do the coaching sessions.
Right. So since this is program driven versus just coursework driven, the only program that has been approved is that grad cert of wellness coaching. And then, like we said before, if you've completed the courses that are in that in another program, you can apply for graduation and get that credential. Um, but for undergrad, it wouldn't be an option. So you'd have to continue on. Um, but that's a good thing. So let's move on to some common questions we usually get from students, sometimes even internally, to try to clarify for our students. And we touched on this a little bit. So does completing the graduate certificate in wellness coaching automatically make me eligible for the exam?
Uh, n- n- No, not that you need to continue on and do the 50 coaching sessions and then you're eligible for the exam. So
Gotcha.
both the grad cert and the 50 coaching sessions need to be accomplished before you take the exam.
Right. And that's a common question that we get is sometimes there's confusion that completing the course of study itself automatically either grants you the credential or automatically it makes you eligible to take the exam. In this case, if you would still need to do your 50 coaching sessions and follow all that. So good clarification there. Does ACHS provide me with 50 coaching sessions during my program or opportunities for coaching?
No, you have to do those on your own. I mean, there's some guidance of where you would get those 50 coaching sessions from, but those are on your own. In the one of the courses, the NAT 515, you do some coaching sessions, but those are not counted towards your 50 sessions.
Right. And to go back and clarify one of the questions we had before about the undergraduate students. So we have on here, you have to hold at least an associate's degree. So there are other programs that are approved at other schools that are at different levels. At ACHS, the only program we have is that the graduate certificate. But another requirement for being eligible to take the exam is that you at least have an associate's degree. So if you complete the degree with us, you would have had to complete it at undergraduate to be eligible for a grad level study. So you should be covered on that one. Just by nature of our requirements to get into the grad cert. But that's a good question, good clarifier. So,
And to add, it's the associate degree plus an approved program by the NBHWC. So both of those have to exist before you can even, apply for the exam plus the 50 coaching sessions. So I just wanted, because it's just not an associate that you need, it's also an approved program by the NBHWC.
right, good clarification. So the third question there, I can take, does the NBHWC have any helpful resources to help me stay on track? You'll notice there's a link there. I've linked it straight to their website where they offer um, really helpful suite of resources for students and professionals alike to either study to get more clarification. I believe you can link up with study groups as well, just to have opportunities to make yourself as ready for the exam as possible. So I would check that out as well. If you're thinking about, even if you're thinking about this in the future, what that would look like, those resources can help you kind of visualize where you're headed. So the fourth question we've touched on a little bit as well. If I completed a similar program or set of courses in the past, am I eligible to take the exam? The answer to that would be maybe. Um, so it depends on when and where that credential was or those courses were completed. With us, as long as they were completed after that April 2025 date, you should be fine. You may have to go back and apply for graduation from the grad cert to get that. But if you've completed the courses in the grad cert that are in that time frame, you should be fine. If you're before that and the courses were different at that time, then you would not be eligible. So that's sort of the dividing line issue we get a lot of questions about, um, but also something that's worth reaching out to the organization to ask. Um, so that covers that last question. All these organizations are usually very open to taking questions. They want to help promote professionals in these areas. So, if we're not able to answer the question for them because we are the education side of it, um, always reach out and just see what they have to say.
There is a question about the Masters in Holistic Nutrition and the 50 coaching sessions. Yes, you would still be required to take the 50 coaching session. The Masters of Holistic Nutrition, however, is missing two of the required courses for the that's in the approved program. So you would need to take those two additional courses, which is HLED and the HED 503 and HLED 553 and HED 503. So the other ones are included in the holistic nutrition, Masters of Holistic Nutrition. So you wouldn't have to do the whole grad cert. You would just have to take those additional courses, assuming that you started your holistic nutrition master's, um, uh, let's see, a year ago, basically, you would have
Right.
had it started.
Well,
And then you would do your coaching sessions after you get those other two, your Masters of Holistic Nutrition and those additional two courses.
exactly. Yeah, and we get that question a lot too. A lot of times new prospective students that are still deciding what they want to pursue, if they've heard about this, and again, some people haven't heard about this till they get into school and they hear others talking about it, and that's fine. But if this is something you want to do before you start with us, we'll get the question of, well, I want to get a master's degree ultimately, but I also want to get the NBHWC. What's better? We generally recommend starting with the grad cert because that is the approved program and coursework that you need. And then when you're done with that, roll those credits over into a master's degree wherever they fit and continue on. So, but as we've touched on, there are ways to sort of retroactively fulfill that as long as you cover all the bases. So great question. But yes, the industry of health and wellness coaching is growing. That's where we see the most buzz out there at the moment. Just in general, just even corporations bringing health and wellness into their staff, and so they're going to be looking for that coaching certification. That's something that stands out. And then, as we touched on before, um, recognized by the AMA as for billing insurance, things like that. So very, very growth industry, and also something that can accelerate your professional credibility as well.
Right. And one thing I would like to add about all of these credentialing is that it really sets you apart from others. So, and employers look for these credentials.
Right. So yeah, completing a course of study is a great first step, but we always encourage students that if there is the next step out there, even if it's not with us, to pursue that, because anything that you can do to show the world what your commitment to your field and your commitment to study and expertise is going to help in the long run. Okay. So now let's move on to the CNS, the Certified Nutrition Specialist. We did a webinar on this one, I believe it was last year. So that will also be linked in this webinar later on. Um, but can you do the same thing? Give us a high level of what this is all about. Who's it for? Who does it benefit?
So the certified nutrition specialist is both a credential and also a pathway for getting licensed in states that require license, that you can get licensed as an LDN. So for the CNS, you do need to have a master's degree in nutrition or a related field. But if you have a related field, you still need to you need to have credits, so many credits in so many different subject areas. So we list the subject areas right there. So you have to have 12 credits in nutrition, but they have to be at the graduate level. So MS or the DSC, and we'll look at the DSC program in a second at ACHS. Then you need 6 credits of biochemistry that can come from either your undergrad or your graduate coursework. And then anatomy, physiology, 3 credits. Again, it can come from either graduate or undergraduate. And then life sciences, same thing, 12 credits, but it can come from either graduate, undergraduate, and then behavioral science, like psychology, graduate or undergraduate. The thing with the Masters of Holistic Nutrition at ACHS covers all of those requirements. So that is one program that you get your Masters of Holistic Nutrition at ACHS. And that had to have been since 2 years ago, because that's when we got approved 2 years ago. And then once you get your Masters of Holistic Nutrition, you are required to complete 1,000 supervised hours by a approved CNS supervisor. So that's a lot of hours. We were just talking about 50 coaching sessions versus 1,000 hours. And you also need to pass the board exam, and then you get your CNS. The exam, in this case, the exam can come prior to the 1,000 hours. I typically recommend you to get some of your supervised hours first, because it will help you pass the exam better. But that's how the CNS is positioned. With the CNS in many states, you don't need to be licensed, and you can still practice medical nutrition therapy. What does that mean? If you're working with a practitioner, they can code for insurance, just like the NBC-HWC. And then there's a number of states that require you to be licensed, not as an RD, but as a registered dietitian, but as a licensed dietitian nutritionist. In some states, it's licensed nutritionist. But that also then, if the states require you to be licensed in that state, it gives you the pathway. You don't have to take the state's exam. You already, with the CNS exam, that gives you, that's the exam they'll accept. And then they accept 1,000 supervised hours as well.
Great. Yeah. So obviously 1,000 hours, that's an undertaking, and that is something to recognize with all of these credentials, is that they require a pretty hefty level of effort on your part over and above the education piece. So we do recognize like how much commitment goes into this. So hopefully we can provide you that foundation to build from. I think it's important to point out that the last credential we looked at, the NBC-HWC, was program driven. So we have a program that is approved, and then we talked about how different courses could be assembled to basically complete that program. For the CNS, although we have programs that we would recommend if this is a goal of yours, this is not necessarily a program approval. It's more of the course approvals that fall into these categories that were covered. So we'll look at that in just a second of how does that actually break down. As mentioned, some of them, the nutrition courses having to be at the grad level, but the others having some flexibility. So there's some good flexibility there, but let's look at that in just a second. But I just wanted to call that out that.
Troy, can I just clarify that?
Sure.
The MSHN at
Right.
ACHS is an approved program. So they don't need to go through your transcripts and all of that when you get your Master's of Holistic Nutrition at ACHS. So
Sure.
that is a
So
program.
all of the coursework that you need is contained within that program,
Correct.
and they already know that with us, you're going to get the coursework, even though they need to know that those courses have been covered. They know that that program is going to cover that. So that's good
Right.
to point out. Let's talk about some questions. You've already touched on how it helps you in your home state, just kind of being that sort of key that unlocks the door in certain states. And is there a specific program? We talked about the MSHN, also the DSC program has been approved, correct?
Yes, with some caveat.
Right. And we'll look at those in just a second. So good to point out. Does AC, this is what we get asked the most, I think. Does ACHS provide the hours required within their programs or provide an internship to get the 1,000 hours?
No, right now there are no coursework or internship types program at ACHS. Any of the supervised hours, if it was part of the program, has to come above and beyond the credit hours of that master's program. So at this time, we don't offer like additional programs that you could, courses that you could tack on.
Right. And I'm skipping ahead a little bit, but they have to be with an approved CNS supervisor, correct?
That is correct.
And how would they go about connecting with a CNS approved supervisor?
The best way is to work through the CNS, which is the BCNS. The board that certifies the CNS is the BCNS. And then the over umbrella corporation of the BCNS is the ANA. So you would go to the ANA.org, and there up there is the information, yeah, the American Nutrition Association. And there you would find the details about becoming a CNS. And also they have contact information there. And the best thing to do is contact them, email them, say what state you are in. They will give you a list of approved CNS supervisors. So that's the
Good.
best way to go about it.
And do those supervisors charge for their time?
Most supervisors, yes, do charge for their time.
So yeah, so obviously, while this is a powerful and recognized credential, it comes with a large amount of effort from just work involved, 1,000 hours, but also financially as well. We recognize that, and again, want to call out that this is something that shows the world out there what you've completed, and if you have, the level of prestige that goes with that. So. Uh, but yes, no shortcutting around the fact that it's a lot of work.
And and in many states, you can call yourself a nutritionist. And if if you go through another program that and you don't have your CNS, there are a number of states that you cannot call yourself a nutritionist, even though
Right.
you did a nutrition program.
Right. Question in the chat is, in the future, is ACHS considering offering client-facing sessions in order to help achieve the 1,000 hours for the CNS?
That is one thing that we're looking into. It probably wouldn't be all 1,000 hours, but we are looking into providing some opportunities to get some of your hours.
Right. So like we started off with ACHS, one thing I love about the school is we're always looking for the next opportunity. So, we can't always guarantee what's going to happen, but it's something that we're always focused on. Can we find other ways to help our students? So, at this phase, just making sure that our programs are aligned to get you where you need to go, um, is the first step. And if there is an opportunity to help build that other stuff in the future, we'll definitely be alerting everybody to that. Um, and yes, we will send out a recording of this to everyone afterward. And you'll have a copy of the deck as well, so you can click on all the links. All right. So we mentioned before the courses. This is a little bit more detailed breakout of how that can look. We won't go through every single one of these, but just wanted you to have access, once you get the presentation, to have a listing of what are those courses that satisfy. If I were to take them all within a graduate program at ACHS, and again, everything but the nutrition could be graduate or undergraduate, but if you were taking from scratch everything at the graduate level, what would that look like? And then, as we mentioned before, all of those courses would be contained or elective in the Masters of Science of Holistic Nutrition. So anything else to call out on that, Dr. Kaufman?
No,
Okay. And then we also have a map for the doctoral level as well. So similar, but a little bit different.
right. Because in the doctorate program, You are not required to do those biochemistry courses, the Newt 502 and the Newt 503. You could take them as your electives. You have 16 credit elective hours in the DSC program. So you could take Newt 502, 503 as your elective. And then most individuals have the Nat 515 or the have the behavioral science because it's a psychology course and it can be a psychology course. And so many have that as undergrads. So that's
Mhm.
usually covered. And then one thing to, if you are interested in and you're in the DSC program or you're going to join be part of the DSC program, um, the life sciences is where you have um, there's one course is required, the 620 is a required course, but then you have the opportunity to take three other electives, which are considered life sciences. So you just need to make sure you take um, two of the additional electives. In the DSC program, the courses are 4 credits at the 600 level. And so that's why you would only need to take three of those
Mhm.
courses and then two of the electives. So one is required, and then you can decide if you take 635, 640, or 630. Um, so I think that's the difference. The all the nutrition courses are required, so you have those covered.
Yeah. And we had a similar question in the Q&A. We have someone that's doing the doctorate program, but their master's does not come from a nutrition background. Can I still do the CNS? So I know we mentioned you have to have a master's in nutrition or related field, but would completing the doctorate with a master's outside of nutrition still qualify?
Yes, as long as it looks like this.
Right. So
So
that,
you would have to make sure you have those biochemistry because most likely you didn't have those in your undergraduate or your master's. You might have had them in your undergrad because that biochemistry can come from an undergrad program. It's
mm,
only the nutrition courses that need to be at the graduate level, which those three courses are required in the DSC program. And again, they're 4 credits, so that's why they equal to 12 credits versus the undergrad, we saw that there was four.
mhm.
So, um, and then the other thing that is not covered in the DSC program, unless you took it as an elective, would be that 64 DSC 645, or you could take as an elective NAT 515 as well. So, and then
And
other electives I talked about.
right. This is why it's so valuable to have Dr. Kaufman here. If you are pursuing the doctorate program with us, you will have an interview. And what I would recommend if hopefully this webinar for students, either to prospective students today or in the future. I know we have some students on today that are active already, but if this is something you're thinking about doing, hopefully this gives you that basis of information that um, as you start the application process or you're interviewing with Dr. Kaufman for the doctorate program, make sure to let us know that this is a goal of yours. Like, this is something I want to pursue, because if she knows that this is something you want to pursue, like Megan's question, and you don't have a master's in nutrition, then that helps us know how it needs to be set up. Sometimes if you're headlong into it and then find out you want to do it, it gets a little bit more complicated. So, um, yeah, so hopefully this just helps the conversation up front for us to all know what you're aligned towards and we can support you in that. Okay, so I mentioned before that last month we had a webinar that was all about this credential, the BCHN with Nicole Hodson from the NANP, which was great. She's fantastic to talk with. I do recommend watching that if you haven't already. But let's do sort of a similar overview. Maybe since we've just covered it in the other webinar, we can move through it a little bit more quickly, but it's also one that's very important to stop and focus on.
So the BCHN is another credentialing that is um, viewed nationwide. And one of the things with the BCHN is it can you can have an undergraduate, you can have an associate degree in nutrition, and you can then sit for the BCHN exam. Um, that BCHN designation is a registered trademark. So you can only use it, once you get certified. But that certification, that credential can be used as your title. Where in some cases, like I was saying, where you can't call yourself a nutritionist, you can use that you're board certified holistic nutrition. No, I think there's only 6 states now that you can't, that are still red. And there's like 7 states still red, maybe it's only 6 now too, that for the CNS too. There are some where the CNS can't do anything, even you can't get licensed or do anything. And that's the same case with the BCHN. But everywhere else, you can put that BCHN behind your name. And you can, within the scope of practice of the BCHN, work as a nutritionist. And so at ACHS, we have a number of programs that get you the pathway. As you know, it doesn't get you the credentialing, but it allows you to then sit for the exam. With the BCHN, you do an exam just like the other ones, and you need 500 contact hours. Some of those can be direct, meaning you work one-on-one with a client. Some can be indirect, where you might be observing. So you might be observing another practitioner, another nutritionist that is working with a client. And that all those details about contact hours are up on the NANP. And those don't have to come before you take the exam. Just like the CNS, they don't have to come before you take the exam. You have up to 2 years to get those 1,000 hours. And actually, I forgot to mention the CNS, you have up to, 500 hours. In the CNS, you have up to 5 years to get those 1,000 hours. But you don't get that credential until you pass the exam and have your 1,000 hours. That's the same case here. You don't get your credential, the BCHN, until you have passed the exam and you have your 500 hours.
Mhm.
And the passing score for the exam right now is 70%. In the CNS, I forgot to mention that passing score, it varies because they basically curve it. So you just need to do better than everyone else. So in some years it's 68%. So you just never know what it's going to be. So I always tell those that are taking the exam, you just need to do better than everyone else. So those are some things just to keep in mind. There are study groups for the BCHN. Once you become a member of the NANP, you can have access to some of those study groups and communicate with others that are in your same looking for study partners, basically.
Yeah, and I've linked to the membership page for the NAMP. This is the only one that I'm aware of, and I could be wrong, where that membership is a part of the requirement. Um, so you can have there are student level memberships, I believe, and then they're professional level. So if you're headed in that direction, I believe Nicole recommended to get in and involved as early as possible because then you're plugged in with that network. Yes, great study guides. They have a wonderful website. I believe they just redid it, which is what Nicole is showing us in her webinar. A wealth of resources. There's all kinds of like we've highlighted study groups that you can sign up for, um, you know, materials to study, things of that nature. So um, I was really struck by Nicole's passion about what she does and how her whole mission is to just grow the credibility and the recognizability of this industry. And so she is a champion of education leading to credentialing and wants to see this flourish for everyone. So she definitely is somebody that if you have questions, would encourage you to reach out to the ANA, or excuse me, the NANP, to ask those questions, get that cleared up, and just see, what should I be doing? If we can't help you, then, that's another resource. Oh, question. Could you do both the CNS and the BCHN?
Yes, you could.
Yeah.
You could
And
actually
you have,
do.
haven't you?
Yes, I have both. And you could for the contact hours for the BCHN, that does not need to be supervised. So that you do a log. So you actually could do some of your CNS hours for that log too. You could double dip if you want. You can't do it the other way. You couldn't take your contact hours from your BCHN and move them over to the CNS because it needs to, unless you're getting it supervised, because
Right.
it needs to be by a supervised CNS provider.
Right. And we do have a link here to their contact hour documentation form, just because it does need to be in the format that they request it. But that's good. That's good advice. I didn't think about the hours that you're earning for in pursuit of the BCHN to or excuse me, the CNS to apply to the BCHN.
Yeah.
Do you know how frequently the exam is offered for BCHN?
It's ongoing. Oh, and so once you submit everything, you have to fill out an application and submit everything. It's usually they'll give you it's proctored and so it's online and they will give you the time frame when you could take the exam then. So they set up an exam time. So within getting all your paperwork in, they usually require a few weeks to get everything organized and then you could sit for it. The CNS exam is only twice a year. So right now it's December and June. And in both of them, if you do not pass the first time, you can retake.
Good to know. So we have a question in the chat about, the certificate of holistic nutrition. Would that lead to BCHN? So we have a list here of the programs that are approved to lead to the BCHN. The certificate's not on there, but one thing, Candace, that we usually recommend is if you complete that certificate in holistic nutrition and roll those forward either into a diploma or associate or another higher level program, you will have completed those courses. You wouldn't have to take them again. So then all you would need to finish is, whatever's remaining for that next level degree. And then you'd be on track. So you're somewhat on the track right now, but certificate is not one of the programs um, on the list. I live in Peru. Do you know if the BCHN or the CNS is more recognized internationally? Interesting question. That's great.
Yes, and I do not know that. So for the CNS, um, the state regulations is where the client lives, not where you live. So say you're working with someone in Maryland that requires a license, you you would need to be licensed in Maryland. For the BCHN, I don't know that exact answer if I think it's the same way, with you need to be working with the individual within the state, because that's how the state laws are. It's where the client resides, not where you reside.
Right. Good point. We've got some questions coming in now. I think this is a hot topic. So, does the BCHN allow for medical nutrition therapy, or is it just with the CNS?
It's just with the CNS.
Right.
And
And
and not all states. If you have your CNS, not all states can you do medical nutrition therapy. It's state by state.
mhm,
But in majority, like in Georgia, if you have a master's of in holistic nutrition, you can then practice medical nutrition therapy with your CNS. So,
mhm. And we have one more question. This might be a broad question that we may need to follow up with. What are the benefits to do one over the other? I imagine they're comparing CNS to um, BCHN.
It really depends on what your career goals are. So if you do want to be able to offer medical nutrition therapy, then you would want to do the CNS. If you are more of a health educator and working with someone on their nutrition, then you may want to just do the BCHN. It's less hours. So it's really where your career goes. If you live in a state that you need to be licensed and your clients will be in that same state, then the CNS is most likely the pathway you would want to take. Texas does not, um, Texas does not require you to be licensed, so you could do either one, the
Mhm.
BCHN or the CNS.
How about California?
California doesn't require you to be licensed either. So one thing I do recommend when someone does their CNS, even if their state doesn't require their license, is to get a license in one of the other states. Maryland is by far the easiest. I think most 50% of the CNS out there have licensed in Maryland. Why? It gets you those three letters behind your name, LDN. Are you going to be working with anyone in Maryland? Could you bill insurance because you're not working with anyone in Maryland? No. But it does get you those three letters behind your name. It helps you with functional labs, working with functional labs. It helps you um, with discounts for wholesale for supplement companies. So there are some advantages of getting that LDN behind your name.
Yeah, good point. A lot of perks. Okay, great questions, everyone. We have one more to cover that's a little bit different. So we'll go through this one and then kind of take a look at an overview. I know we're getting short on time, but hopefully you can stay on with us. So the last one we're going to touch on is the CHES, or the Certified Health Education Specialist. So brought to us by the National Commission for Health Education Credentialing. And this one would be more targeted towards people who want to teach in some way in health and wellness. It doesn't necessarily need to be in nutrition, but like if you are um, pursuing, to become a teacher or instructor of health and wellness at a school, a company, maybe you're pairing this with um, a, a, a personal trainer certification to kind of add that on. So anywhere where you're going to be teaching, to have this designation that you've been certified as a health education specialist, even if that's chained on to other things, that's another way to think about it. Um, for this one, you do have to hold a bachelor's degree, a master's degree, or a doctorate degree. So an associate or a certificate wouldn't quite get you there, but it's at the bachelor's or above level. So this one's a little bit different. And instead of being program driven or course driven, it's driven by these 8 areas of responsibility. So you have to have at least 25 hours of semester credits in the 8 areas of responsibility to be able to apply for the chess exam. It's only offered twice a year, April and October, and I believe the April one is already closed, but it's on a rotating cycle. And then after you've achieved the certification, you do have to do continuing ed to maintain it. So 75 credits every 5 years. So um, we'll take a look at what these eight areas of responsibility are in just a moment, but um, the question we get about this one doesn't come up as much, but it is something that we have questions about periodically. Are there any contact hours or internship or practicum hours like we've talked about before with the CHES? So the answer to that is no. This is all about just completing those areas of specialty and responsibility. Um, are there any programs at ACHS that provide the opportunity to satisfy the 25 hours aligned with the 8 areas of responsibility? We're going to look at the courses that cover those 8 areas. So any of our programs that have those courses in it, or where you can take them as electives would count because they're not tied to a specific program in this case. And if I've taken some courses at another school that may qualify for the part of the 8 areas, can those be considered? Yes. So you can transfer in. So since it's not program specific, if as long as you've taken coursework in all of these areas, you can have that evaluated just to make sure. But what we would recommend is just if you are going to take a course of study, all at ACHS, just make sure you take all of these courses together so they're fresh in your mind. Yes, we will send out a recording of the webinar.
One thing, Troy, I wanted to add, so both the BCHN and the CNS also do require continuing education. The CNS is 5 years. I think it's 75 continuing ed.
So similar.
And yes, and similar. So, and can I just clarify, someone asked about California, and I just want to clarify that. They asked if I said California doesn't require licensing. That is true. But if you get your CNS, you can practice medical nutrition therapy in California. So I just wanted to.
Oh, thank you. Thanks for pointing that out. Okay, so let's take a look at what are these 8 areas. So these are the 8 areas of responsibility that the CHSES would require you to have experience in for the exam. Um, we don't have a single course for each one of these, so there's not 8 courses you need to cover. We'll look at those in just a second, but these are the areas that they want you to be familiar with. So some of our courses cover multiple of these in one course. So that's a benefit there. If you click on this link right here, it will take you to their website to get a little bit more information about that. But just wanted to highlight what kind of things they're talking about when they're saying the 8 areas of responsibility. So as you go on to, educate or teach others about health education, what do they want you to be aware of and trained on? And so here are the courses that you would want to have kind of in your orbit if this is something that you're considering. The HL, you'll notice all of these are graduate level courses. So while you do have to have, kind of like we talked about before, you have to have a bachelor's or above, but these are the courses that we have that cover all of these areas, and they're contained within the Masters of Health and Wellness or the Masters of Integrative Health Sciences, either as the core or elective courses in there. So, and we have a little bit of a description about, how they relate to those 8 areas, what you're learning in there that sort of checks the box, so to speak, for the 8 areas of responsibility. So if you're like me, your head is probably spinning at this point. There's a whole lot to consider here. So many letters, so many things. Some are program driven, some are course driven. Some are course driven but have programs that contain them all. Some have hours, some don't. Some have coaching sessions, some don't. So hopefully the webinar is something you can fast forward, rewind, pause, go back, listen to it again just to make sure you have all of that information. But I would recommend at the end of the day, also research this on the website of the organization that offers it, because they're the source. They're the ones that make the decision. So we've put together this little overview of what we've talked about today to try to, simplify down, are they course driven or program driven? What additional work needs to be done over and above the education component? Is there a time frame that they need to be completed after, or is there a degree level that you have to maintain? There is a link here for each organization. Again, some more letters, but that'll take you right to their websites. And then all of them require a board certification exam before you can, take on that designation. Okay, so let's see where we are. We have 1 minute left, so we may not get to the admissions part of things, but if you are interested in any of this, if you're thinking about programs at ACHS, please reach out to your admissions advisor and we'll do our best to answer your questions or get them answered as best we can or help you direct to the organization to make sure you're confident in what you're about to step into. Um, so I had a section for questions. I think we've been answering them along the way, but there was one more. Do both require malpractice insurance? I assume CNS and BCHN.
The when you're licensed, LDN definitely it requires nutrition liability insurance, which is a little bit different and a lot cheaper than malpractice insurance. In most places, you can get it for like $170 a year.
Mhm.
And that does cover you. I don't know that question as far for the BCHN, just because I got my BCHN after I had my uh, LDN, so I'm not quite sure if you do need to have that insurance.
Good to know. All
Oh,
right. So,
yes, you can. Someone asked for my email. It's Patricia
okay.
Kaufman at achs.edu. That would be the best way to contact me.
Gotcha. Thank you for that. The links here to the previous webinars on our YouTube channel where we had a deeper dive on the BCHN and the CNS. Um, if this was your first time hearing about it and you have not seen those, I would highly recommend taking a look at that or just exploring our YouTube channel in general. There's just a lot of information there that might answer your questions or may, spark new questions. So we're happy to provide that resource and help out any way we can. You'll get the presentation afterwards. It has links if you are looking to how to apply, how to get your transcripts, things like that. But you can also reach out to your admissions advisor and they can, walk you through the process one step at a time, definitely. Summer semester's coming up. Summer two will be following after that. Um, a lot of changes on the horizon in the education world. So there's a lot of folks that are looking to get started in summer because it's the last available start date before the end of the academic year. Academic year in the higher ed world splits in June 30th to July 1st instead of in December. So a lot of folks trying to get enrolled before that date. So if you are looking at either of those, I would suggest let us know as soon as you can so you don't get stuck in the rush. But we can also help strategize with you for our fall term as well, if that is something that would fit better. And this is our team, the admissions team. You may have spoken with them already. Some of you are already students. I know you probably have worked with at least one of these folks. They're here to help. They're here to be your advocate, but also to go find information if they don't have it. So we are all in the process of learning all about these credentials ourselves. We have some great folks here like Dr. Kaufman that help us out tremendously. So we're all here to help. And want to see you succeed. And we appreciate it. Thank you for spending time with us, going a little bit over time, but hope you have a great afternoon and be well.
Bye. Thank you.
Bye, everyone.